This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo. Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist, and...
I'm not. I'm Janet Novotny-King. I'm the doctor's sister. I'm a regular dog owner, rescuer, pet lover, and I'm here to help you all understand better these large words and terms that these experts start using when, we all kind of get confused. And I'm asking the questions that I forgot to ask when I left the vet's office. So here we go. Alice, who do we have today? It's a three-peat.
We have a three-peat, which means they're an honorary co-host.
Oh, that's
just like Dr. Rustin Moore, who's an honorary co-host. We have another honorary co-host, Dr. Karl Jandrey, our favorite emergency room critical care specialist at UC Davis, University of California, Davis, College of Veterinary Medicine. We are going to talk about heart disease in your pet today, because a lot of you don't realize your pet has a heart problem until you get into ER and see Dr. Jandrey, and he's here to tell you, hey, this is what's going on. And we're going to talk about some of the symptoms that you can watch for in your pet that means they have heart disease and what to do about it. So again, our favorite ER specialist, Dr. Karl Jandrey, welcome.
Thank you so much. That means you probably don't know any other emergency critical care specialists.
No, you're at the top.
Yes, we do.
Well, at least I'm on the top of someone's list. This is awesome. And
that's
when
right.
You guys go on vacation and you need a break, I guess I'm happy to take over.
Okay.
Oh, and please invite Dr. Michael Kent, too, who is very famous for his part in curing the golden retriever with melanoma.
Lola, did you see that big story?
I did, and I actually emailed Dr. Kent and said, what a wonderful outcome that was.
That was kind of a surprise for the whole oncology team here. It was, physiologically it makes sense, but it's not a common response, especially that it was such a delayed response. And, we're smart, but we don't know everything, and things still surprise us in medicine. So it was pretty cool. And Lola is just super special. So if anyone hasn't seen Lola, go online, check out Lola, golden retriever from UC Davis overcoming her cancer. It was pretty cool.
That's good.
That story it gave me goosebumps. It was just, Janet, the crux of it is, and correct me, Karl, if I'm wrong, she was on an inhaled chemo? Is that right?
Yeah, she had, I don't know the full story because I'm not an oncologist.
Yeah.
But she had some traditional therapy for her chemo, and then she had an inhaled, I forget the exact type. It was a part of a clinical.
I think it was doxorubicin.
It was a part of a clinical trial, and it didn't really do all the things it was supposed to do. But then, after time with other therapies, the pulmonary metastases went away. I think, in short, is that what you remember?
It's gone.
That's incredible.
Isn't that fabulous? Yeah. I mean,
it's fabulous.
Yeah, that's the world of radio
anyway,
immuno-oncology is becoming the big thing. So immuno-oncology for sure, taking the body's own immune system and jazzing it up to kill the cancer, because cancer usually grows when the immune system isn't really doing its job. So it's almost like retraining your immune system to kick out the invaders. And using traditional chemo or new types of chemo and or radiation therapy to jumpstart your immune system are really new advances in oncology. So this is where my partner and a lot of our teams here at UC Davis are moving.
it's like a miracle.
Our dad had cancer for 10 years, Alice and I, our father, and he did some experimental chemo at the Cleveland Clinic at University Hospital, whatever. I can't remember which one it was, but I just remember the amount of hope that you have. Do you know, as a family member, every treatment, and we'd wait for that one number. Is it going up? Is it going down?
Yeah.
In layman terms. And you just hope that it will help other people or animals along the way, all this research.
Yep.
So,
And it's really amazing
And a
that
big shout out to Dr. Sandy Markowitz, our dad's doctor, and just an overall lovely person. Yeah.
Yeah.
Sorry,
Mhm.
Carl.
And no, that's great. I mean, you have to have a call out and shout out to your oncologist because they work super hard and they get very little credit.
They do. And I remember
Right.
it being a layman and him explaining to me, I said, why isn't the chemo working? And he said, at some point, the cancer outsmarts the chemo. And for me, that was like oh, now I get it, So
Yeah.
yeah, that's pretty cool that this Lola is around.
Let's talk heart disease, though.
Mm-hmm.
Dr. Jandrey, tell us, let's start with dogs.
Okay.
What are some of the symptoms of heart disease in dogs that an owner should pay attention to?
Should look for, right?
Sure. I'm going to preface this whole day by saying I'm an emergency critical care specialist. I'm not a cardiologist.
Right.
However, I'm the second best cardiologist. Emergency critical.
Yeah, right.
I mean, really, emergency critical care specialists have to be the second best in everything. We're the second best dermatologist. We're
Yeah.
the second best gastroenterologist. We're the second best neurologist. Because there are other people who have specialties in those areas and they know a lot more deeply. However, because animals show up to the emergency room with no diagnosis plastered on their collar, like we have no idea. They're
Right.
just brought to veterinarians in the emergency room because the client says, something's not right here. And we have to be the problem solvers. We have to use sort of a problem-oriented approach to say, okay, tell me more. Let's talk about the findings you're seeing at home. And in our database of what we know, we can start thinking through those millions of possibilities and narrowing it down to maybe tens of thousands of possibilities. Then maybe with a physical exam, getting it closer to maybe 1,000 possibilities. And then maybe running a few tests, we are going to now say, oh, we got about 40 or 50 things we're thinking here. So, it's a funnel from unknown to the diagnosis, but veterinary emergency and critical care types have to sort of really be the second best at everything because you have no idea what is coming in. And, animals with heart disease have symptoms that can overlap with other diseases as well. So one of the I would call it a stealth symptom that animal owners may not recognize in dogs as well when they have heart disease is what we call exercise intolerance. Exercise intolerance isn't, I don't want to go for a walk, I'm stubborn. It's, I'm happy to go for a walk, but I now tire easily. I no longer can sustain my activity. I used to walk 3 miles a day with my owner. Now I can only walk 1.5 miles. Or I walk 1 mile and I need to take a break. And then I walk the next mile and then I take a break. And those
Are they kind of huffing and puffing at that point?
sometimes that's
It's
a good question, Janet. A lot of times it's so stealth, it's just inability to sustain the activity with nothing else. They'll just stop and they'll lay down and they'll act stubborn and clients are like, oh my God, this dog is so stupid. It's so stubborn. It just wants to meet Betty down the street or whatever. Sometimes they start having other symptoms, but some of the first most stealth signs are just inability to sustain their activity.
interesting.
And I think a lot of people think, oh, that's just old age.
Yeah.
And when you chalk up old age, I mean, everyone gets older, but a lot of people are still very active as they get older, so there are a lot of other diseases, especially metabolic diseases, hormonal diseases. Those things can also show up with inability to sustain activity too, even some neurologic diseases. So like I said, it's kind of stealth and it kind of spins across multiple different body systems. It's when, Janet, like you said, starting to huff and puff a little bit, when those types of signs start happening, it now starts my brain going, oh, maybe this is a little more towards the heart and the lung. They can't sustain their activity, and now they're actually showing increased respiratory rate, increased respiratory effort, meaning they're breathing harder. Like you actually see them bobbing their head and their body. Maybe they even move their elbows away from their chest, and they look a little more barreled, like a bulldog instead of like a poodle.
Right.
So that symptom of difficulty breathing, like it looks like they're working harder to breathe, whether it's faster or deeper, more thoughtful. And there's actually some animals who have to stop while they're eating and drinking and take a few extra breaths because it's hard to eat and breathe at the same time. Breathing is supposed to be imperceptible. It's supposed to be effortless. But when you start noticing effort, it becomes a problem.
How is it diagnosed? Like, what are the tests? What's involved?
Can I ask a question before you get into that?
Yeah.
What about coughing? Do they cough?
I would have to tell you that in some animals, they do cough. And we're going to talk about why this happens in a second. But increased respiratory rate and effort is, inability to sustain activity or exercise intolerance. Early sign, very, very early, often not visible to the client. Increased respiratory rate and effort, people pay attention to that. But, after the animal rests, their breathing gets better, and often we delay getting attention. But when they start to do things like coughing and having respiratory breath, now we're starting to layer more and more things on. That's when clients maybe actually say, hey, I think I need to have this checked out. Coughing is one of the worrisome ones, especially if they're coughing out any kind of sputum or fluid. That kind of increases our suspicion that something's going on in the lung or in the heart. So definitely in the chest cavity. A lot of these signs do get better with rest. So people will say, oh, that was interesting. Let's give it a day or two. Animal's still eating, animal's still drinking, peeing and pooping is going fine. They just give it a break. No problem. But it's when it gets beyond the level of their comfort, where they notice it happening more frequently. These are the things we hear when the animal's brought to us in the emergency room. And often the animals are brought to us in the emergency room with increased respiratory rate and effort and coughing. And the next step, you ask, what's the next best test? Honestly, the next best test is visit a veterinarian and get a good physical exam. First and foremost, the most important test is have a veterinarian put hands and ears on those animals, because when you start to listen with the stethoscope to the heart and the lungs, you start hearing some things that are now going to say, I was suspicious about heart and lungs because of your history. Now I'm definitely worried about your heart and lungs because I now hear really weird things with my stethoscope. And if we hear weird things, then we're like, is it heart problem? Is it lung problem? Because, the heart and lungs are really kissing cousins. They need to work in unison together. And sometimes they look like each other's diseases. So then it's our job to decipher, is it something like pneumonia? Because pneumonia is going to do the exact same things we just talked about. Exercise intolerance, increased respiratory rate and effort, and coughing, because they have pus in their lungs from some reason. Well, when you have a heart that's failing, you have liquid in your lungs because the heart's not pumping your blood very well around the body. So it backs up. Because of the backup, it leaks out. It leaks out into the lung, which I think is super cool. And that creates the exact same signs as pneumonia. Lethargy, exercise intolerance, increased respiratory rate and effort, and then coughing. So we listen for our stethoscopes, and if the heart has a murmur and the weird lung sounds, then we're like, oh, I think this is the heart deriving the lung problem, not the lung problem causing anything else. So first and foremost, the test is a physical exam with a good stethoscope and a smart emergency veterinarian.
Wow. And then what happens next? So say my dog is diagnosed with a heart issue. Is there medication? What happens next?
And are there certain breeds that tend to have heart disease more than others?
Gosh, you guys are full of questions. It's
know.
like it's
That's our
Monday, but it's
job.
not Monday.
We want to know.
I love it. So breed
Inquiring minds.
I mean, veterinarians who have been taught well and who have experienced this are very suspicious about certain breeds. There's certain breeds where we're like, here it comes, a coughing, fill in the blank breed. And you're like, it's probably going to be heart disease, because heart disease is common in those breeds. So let's talk about breeds for a second before we go to Janet's question.
Okay.
So there are, let's call them, I'm talking in generalities here because common things are common, but two big classifications of dogs and two different types of heart disease. The smaller breed dogs tend to have valvular disease. So what's a valve? The valve is a little structure, kind of tendinous in between the chambers of the heart. And when this valve is not working as well to keep the blood in each chamber of the heart, it leaks. And as it leaks, it causes deformation of the heart, it causes blood flow problems, and it causes typically backing up of blood into the lung to cause their symptoms that we talked about. So those dogs that typically have valvular disease, there's many valves in the heart, but the most common one is mitral valve disease. It's one we see the most commonly, and it's typically in smaller breed dogs. Certain species of smaller breed dogs have a higher predisposition, a breed predilection for, not 100% always genetically because of this, but Cavalier King Charles Spaniels have mitral valvular disease, little poodles, Chihuahuas, I'm talking smaller breed dogs. So we're talking probably under 20 pounds, 10 kilos or less. A lot of these animals will have valvular disease. They'll have heart murmurs, but many of them don't progress into heart failure. It's the ones who have the worse, the more progressive, the more dangerous and insidious creeping up of the valvular disease that go into heart failure. But we see a lot of older small breed dogs with valvular disease that don't have heart failure, and they don't necessarily need to be on medications. So that kind of leans to your question, Janet. Are the medications? What else do we do? So we'll dive deeper into that. But a small breed dog tends to have a valvular disease. It's usually the mitral valve. It causes a murmur. If the murmur and the valvular disease gets worse, it backs up blood. The blood backs up into the lung leaks out the serum, the plasma part, out of the vessels into the lung, floods the lung, causes the signs we talked about: exercise intolerance, increased respiratory rate and effort, and coughing. Small breed dogs. So I feel like I'm giving a lecture. Tell me if I have more questions that you need.
We love lectures.
So the other set of dogs,
me not so much, but
the other set of dogs tend to be big dogs. So it's not necessarily that they commonly have valvular disease from mitral valve disease, but the bigger breed dogs in my window of emergency critical care, the bigger breed dogs have something called dilated cardiomyopathy. Dilated cardiomyopathy means the heart is bigger and the wall is thinner. So the muscular wall that actually is the pumping part of the heart, that is weak. So let's make an analogy. If you get a brand new balloon and you blow it up, it's really hard because the wall is really sort of thicker and more strong, right? If you blow the balloon up and down and up and down and up and down, after time, that thickness gets thinner and you find it easier to blow up the balloon, right? If you remember back to your childhood, blowing up balloons, after you blow up the first time, it takes a lot of pressure to blow it up. When it's an older, more used balloon, it's easy to blow up. That's because the wall's thinner. It doesn't really have the strength anymore. So big dogs tend to get this dilated cardiomyopathy. It's more common in like Great Danes. We're talking big breed dogs. Great Danes, Doberman Pinschers, Golden Retrievers can get it. And then this is often a breed-associated problem. It's not necessarily genetically based, but it also can be due to recently grain-free diets. We noticed in our team here at UC Davis found the reason that a lot of not older necessarily, bigger breed dogs were starting to get dilated cardiomyopathy, which is really unusual for it to develop if it's a golden as opposed to a Great Dane. And they found out that the diets that were grain-free had a very low amount of amino acid called taurine, and this was putting these dogs at risk. So supplementing with taurine and getting them on a better diet actually reversed their dilated cardiomyopathy. It made their weak heart muscle stronger again. So my brain goes into small breed dogs, mitral disease, big breed dogs, dilated cardiomyopathy. I ask questions about the diet. What is your animal eating? What's your animal's activity like? What kind of work do they perform? Are they a couch potato? Or are they a herding dog? Do they actually have a job, or do they just look cute? Like, what are their lifestyles? I need to know that because that helps me to determine how much we're going to do with diagnostics, with therapy, and what my goals are going to be.
Wow.
Yeah.
Is the pet uncomfortable with this disease? Like,
My patients don't talk to me,
I know.
but I could ask questions of the client to try to determine if they are uncomfortable or if they are not thriving. Because I think animal owners know their animals' patterns the best.
Yeah.
You know when they're
Yeah.
happy, you know when they're super hungry, you know when they're responding to their environment in a normal way. But if they're starting to be disinterested in food, isolate themselves a little bit more from the family, no longer love their favorite ball, they're just kind of like meh about their favorite ball. You're like, that's kind of weird. And it's kind of subtle. And it kind of, like Alice said before, chalked up to maybe they're just getting old and they're just becoming disinterested because they're old. I mean, I don't think so. I think if you think about the things that your animals love to do the best and they're not doing them anymore, that's a red flag. I would get someone to help you out to try to figure that out.
Blue Buffalo Natural Veterinary Diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well pet and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents. Blue Buffalo Natural Veterinary Diets.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry. And I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
So what is life expectancy?
Oh gosh, you're jumping way ahead.
Okay. Well, as a pet owner, I'm thinking, wait, look, we got one sleeping. Can't really see her. Libby. Sleeping on the job.
I can tell you, back to are they uncomfortable? If they have respiratory distress, if you can obviously see them breathing hard with effort, increased rate, they are not comfortable. If you are a person with that, people with that kind of respiratory problem say it's horrendously irritating and uncomfortable.
Yeah.
Like, it's hard when you can't breathe, right? So,
hey, I've had pneumonia and it was like torture.
Okay, think about that.
You can't fill your breath. Yes. It's hard to explain.
I feel bad
it's
for anyone
difficult.
with asthma, starving for air.
God.
That's going to be terrible. Unable to breathe because of pneumonia. It hurts when you breathe. Your ribs hurt. Your muscles of your ribs hurt. Oh, yeah. So
you completely lose your appetite. Like food was disgusting.
Yep.
Yeah.
I would have to say that I don't know if they're painful, but I can tell you that they do not do their normal things and they do not look like they're happy and they don't look like they're thriving. So I assume it's uncomfortable. I know people say it's terrible.
Yeah.
So when you know your dog is doing well on therapy or cat, they're doing their normal things. They're breathing comfortably. And one of the most important things we teach people how to monitor their animals with cardiac disease, simply count their respiratory rate at rest. It's super easy. You don't have to do it by standing on top of them. You can do it from across the room. Just watch their chest rise and fall. Count how many times they breathe in 1 minute. And if it's 30 breaths a minute or less, not a problem. It's probably okay. Of course, I say at rest. That means when they're quiet, not after you've just come in from a long walk or after they played ball and because they were super excited after dinner. At rest. And then you don't need to worry about it. However, if you feel that all your medications, all your therapy, all your environmental changes aren't working so well, their respiratory rates are probably going to be higher at rest. And as the higher the rate goes, the more you're going to get into your veterinarian. Because
what's the normal rate?
Like my dog's right here. I mean, Janet, maybe you can count Libby's, but my dog's right here at my feet right now. His respiratory rate, he's totally sleeping. Wait, now he's dreaming. So honestly, his
Is he talking? I love when they dream and kind of talk in
he
their
likes to
sleep.
wag his tail really hard in his sleep. So you hear this thumping, and you're like, "What's going on?" And you look over, and he's wagging his tail at something.
He caught something in his
He's
dream.
probably breathing about 12 to 18 breaths a minute right now, but he's asleep.
Okay.
So sleeping is different than wakeful rest.
Right.
So wakeful rest, I would say between 20 and 30 is good.
Huh.
Okay.
Mine increases after when the UPS man comes.
I know.
Now, Carl, I have heard that some large breed dogs with dilated cardiomyopathy, like you're talking about, you let them out to go to the bathroom in the morning and they'll just collapse.
Yeah.
What's the story behind that?
Oh, gosh. So,
first of all, can you explain what that cardiomyopathy, what does that mean?
thank you for asking. We always forget. Cardio, heart, myo, muscle, pathy, disease of. So, disease of the heart muscle. And we're going to talk
There you
about
go.
cats. I think we're going to talk about cats today, right?
Yes,
So
we are.
cats also have a cardiomyopathy. It's not dilated. It's called hypertrophic. So we're going to talk about that. We'll define hypertrophic when we get to cats. Okay, so where were we on our question?
The collapsing in the
Collapsing,
backyard.
okay.
Collapsing in the
So
backyard.
more commonly when dogs have dilated cardiomyopathy, remember I told you their hearts get bigger and stretch. As it stretches and it's larger, the electrical conduction of the rhythm gets disrupted. So there's often an accompanying heart rhythm change when hearts get super big. And the most common one is called atrial fibrillation.
Yep.
And you probably heard of atrial fibrillation in humans. It's a relatively common heart arrhythmia. A rhythm, rhythm. A means abnormal. Arrhythmia, abnormal rhythm. So we look at the electrocardiogram. So that's the EKG or the ECG that you may have seen on House or ER in the day.
Actually, a friend of ours had AFib kick in, and they went back on the record on his watch, and it happened like last August when he was golfing. They could see it go, or whatever it did. They went right to the date and time because of the watch. I thought that was super cool. But I know our pets aren't wearing the watch. But
funny enough, there's a big push for wearable biometric things in people and in animals. At one time, there were collars for dogs that measured activity. And so if you're in a client at home and you're trying to say you're working all day and you don't know what your dog's activity is like, you can track it with the collar. And then if you're worried about their exercise intolerance, you can actually get objective data from these wearable trackers. So we can turn sort of a suspicion, like I think he's not as active. We can turn the suspicion into actually data, and the data can actually be tracked. So there is a way to actually take some of the subjectivity out of it. It's not essential, but this is one of the reasons that a lot of people are sort of pursuing wearable biometric data monitoring things for animals. Biometric, bio meaning physiologic, things that are going on in your body, metric, measurements. So
very cool.
It's cool. That's like your Fitbit.
You can see how many steps like Libby took today.
Yeah, you could. And if you're trying to do like a weight loss program, you can say Libby takes 6,000 steps a day. Your vet might say, get her up to 8,000 steps a day.
Yeah. That makes sense.
And when you leave the house, you think they're just lying there and they're really like running around.
Could be. You never really know unless you got those little pet cameras.
You don't.
Alice knows because she has the cameras.
I do.
We'll be out at dinner. Oh, they're lying on their bed.
I know.
Sometimes I don't want to know what they're doing. I'm just like,
Yeah.
Just
invasion of privacy.
maybe. I kind of feel that they need their space away from us, right? So they might collapse. Back to your comment. If the heart rhythm, the AFib, the atrial fibrillation. Atrial means it comes from the atria. That's one of the chambers of the heart. Fibrillation, fib is it's irregular. Fibrillation is like fluttering. So this is a abnormal instead of a lub dub, a nice solid. Like a big breed dog, a big Great Dane probably has a normal heart rate at rest, 60 to 80, like a human. But at activity, he might go up to, or she might go up to 100, 120 running around the yard. But atrial fibrillation, the heart rates typically go up to like 240, maybe 300. And when your heart is like, instead of being like a pumping mechanism like a normal heartbeat, and it's doing this, there's hardly any blood getting ejected to the body. So it doesn't go to the brain. The brain says, I feel kind of starved of oxygen, and you collapse. Also, your muscles aren't getting the blood flow to sustain the activity, so they don't work. So you can't move, so you collapse. It's not necessarily a super fatal arrhythmia, but it can be if it's sustained and there's no blood flow getting pumped out. But sometimes these guys just collapse and they're brought in right away, and we can try to do things to try to control the heart rate. In most cases, initial therapy, these guys need oxygen because sometimes it's really hard to get the oxygen through their lung into their blood because the heart has backed up and put this congestive fluid in the lung, so we don't get a lot of oxygen. So one of the first things we do in the emergency room, get an intravenous catheter in, give them oxygen, do our examination. Do we hear the bubbly wet lung sounds? Do we hear a murmur? And then also we have fancy point of care ultrasounds that we can do a quick ultrasound of the heart to see if it's got a valvular problem or to find out if it's dilated. We can use that point of care ultrasound even before an x-ray to give us more information, which helps us say this animal needs medications to reduce the fluid in its lungs. This animal needs antibiotics if it's pneumonia. This animal needs to have its heart rate controlled. And all the while we're checking its other vital parameters, measuring its blood pressure perhaps, giving it oxygen for sure. And oftentimes because respiratory distress is uncomfortable, we give them some pain control, to tell you the truth. We tend to default to give them pain control for two reasons. One, people report how uncomfortable it is to have respiratory distress. And two, we often need them to calm down a little bit. So the pain control can really give a little bit of sedation.
They're afraid.
And that actually helps them to sort of maybe mentally relax. We know we see them physically relax. And oftentimes that's part of the treatment of their heart failure is to actually slow the heart down a little bit too. Because when your heart goes into failure, it more commonly fails when it's going too fast. Like atrial fib, when it's going 240, 250 beats a minute. And when you're in heart failure from like mitral valve disease as a little tiny dog, typically your heart's trying to pump really fast because it's inefficient. So you also have a higher heart rate. There are some occasions where heart rates are super low when you're in failure, but that's really rare and really uncommon. I'm just speaking in generalities for the little dogs and the big dogs.
But before we go on to cats, thankfully there's medications for both of these types of heart disease, right?
Yeah, for sure.
Carl? The dilated cardiomyopathy and the valvular
Exactly.
problems.
So when you have the valvular problem, there are actually, let's talk about the most amazing thing that we can do. There are surgeries to try to fix the valve itself.
Like
in humans. Humans often get a valve replacement.
Right.
They've worked on valve replacement surgeries and done a bunch of different species. Of course, to get it into people, we had to do valve replacements in sheep first. So we have all that data and we've done it in multiple breeds. It's not super common that a sheep presents to us and needs a new heart valve. It's mostly little dogs. There's a lot of surgeries they do to just tighten up the valve a little bit. They don't necessarily have to replace it. They can do some adjustments based on little trickery and little stitches, but it's open. It's basically a heart surgery, so it's pretty risky and expensive. And it's very niche. It's not very many veterinarians in the world do that. But most commonly, if the heart is not working as well, and it's a mitral valve disease process, we talked about how that backs up blood. It doesn't pump forward very well. It regurgitates because the valve is leaky. It regurgitates up into the lung. It causes lung fluid. We call it congestive fluid. It gets into the lungs just like pus would get into the lungs. It's formed differently, but it lives in the same place. So we have a medication to try to reduce the volume of fluid that is backing up. And that drug is called furosemide, or Lasix is a trade name.
Okay.
Furosemide is a medication that actually tries to teach the kidney to excrete a lot of extra fluid.
Okay.
When you excrete that extra fluid, you give your heart a bit of a break. And when you, the side effect of that is the fact that you are going to maybe become dehydrated because you're teaching the kidney how to get rid of extra fluid.
You might get rid of too much fluid.
Yeah, if you get rid of too much fluid, you get dehydrated. But
Yeah.
when we're talking about the heart's got to win right now, and the kidney's got to do the work, and maybe the kidney's going to suffer a little bit. But we often have the heart. I mean, it's fatal if your heart's going to fail. So we need the heart to win. So we give them furosemide. We potentially stress the kidney to work harder to get rid of extra fluid, but the heart needs that right now, and the lung needs that right now. So we give them oxygen, calming medication, pain control, and furosemide is the easiest way to start with a dog with mitral valve disease. And there are other medications to add on to the mix, but like in the emergency setting, that's where we start. And then we call our cardiologist to do a real echocardiogram. That's a moving ultrasound of the heart, looking at it in real time to help measure the chambers, measure the valves, look at the valves working or not working, looking at the flow of the blood, what direction is it going, what's the speed of the blood. We can do all these kind of measurements with a beautiful ultrasound provided by our cardiologists. And then we can help fine tune the medication for the chronic management, because most commonly we don't fix the valve, and most commonly we manage heart disease as a chronic process. It's a chronic disease that we will have on medication for a long time, like diabetes, always on insulin because your pancreas isn't making the insulin. So they're on their medications for the rest of their life. And their life is going to vary based on how diseased the heart is when it's diagnosed. So I would probably say on average, this may not be the most accurate, but it's a median. So about half of the dogs live longer, half of the dogs live shorter, about a year from diagnosis.
Oh, wow.
So they can be, and they're generally smaller breed, older dogs.
Right.
So if they're 16-year-old Chihuahua and we get them to 17 and a half, that's a win.
Yeah.
But we're managing it the whole time, and we're trying to prevent them from having other episodes of failure. So we have to manage them well, have them on a reasonable, consistent diet, have a reasonable, consistent activity program for them, because we can't let them go out and necessarily herd sheep. That's too much activity for a dog with heart failure. But being comfortable in a sunbeam, sitting on the couch, walking around the block, not too bad.
Pretty good life.
Oh, yeah, that's why we have them, right? We're just all about giving good lives to our critters.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems.
They make a food allergic diet that's an alligator-based called NP, or a hydrolyzed salmon-based for dogs and cats called HF.
So please, ask your veterinarian about Blue Buffalo prescription diets.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry. And I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
Now, what's the difference between heart disease in the dog and the cat? Do they have some similarities, or are they totally different?
The similarities in the cat, even though they start with a different cause, the end result kind of is the same. So,
okay.
Let's see. Did I finish my thought on heart disease? Oh, one last comment about treating heart disease. We didn't talk about how do you treat the weak, flappy, big, dilated heart.
Right. The dilated.
So, again, get to the veterinarian, oxygen, measure things, listen, maybe do a quick ultrasound, see it's a dilated heart, maybe the rhythm, we have to slow the rhythm down, we have to give them pain control, la la la. So, but the long-term therapy, if they're not due to grain-free taurine deficiency, if it's genetic or very highly predisposed, those guys we can give drugs to try to help strengthen the contraction of their heart. So sometimes we need to be on furosemide or Lasix, but sometimes more commonly they're on medications to actually help that thin heart muscle, instead of being weak and flappy, to be thin but stronger. And these muscles actually help tone the contractility of the muscle of the heart through a very cool mechanism. And there's two common drugs. The old school drug, the one that we used forever, Alice and I were trained on when we went to school, digoxin or digitalis glycosides. It helps, it can create arrhythmias when toxic. It has what they call a small therapeutic index, meaning a little bit's perfect, a little bit too much can make them toxic. So there's a newer medication that actually has a much larger therapeutic safety margin. That's called pimobendin. Pimobendin is a great drug that's been we've been using probably for 10-ish years now. We didn't learn about it in vet school in the 90s. But pimobendin is another drug that helps improve the contractility of the heart muscle. So most animals go home on a little pimobendin if they have DCM.
A quick question, Carl. When these dogs come in heart failure, despite with the the dilated cardiomyopathy or the mitral thing, do the owners notice a big change then when you guys do your magic control the arrhythmia or the heart rate? I mean, is it a dramatic change, or they just get to kind of like, you see what
I mean, I see a dramatic change in the emergency room and in their first overnight stay. So I mean, we work hard and fast, because when the heart's failing and it's filling up your lung and you can't breathe, like, we need to fix it now. So we actually often have them only in the hospital overnight, and we get them kind of in a space where we wean them off of oxygen and get them home as soon as possible. So we have to really work hard and fast to clear their lungs, help them breathe better with lots more oxygen, and try to uncover the underlying causes, and then get some directed therapies that might help even more. And if we can get them to that point, then they're often just in oxygen overnight, weaned off, and then sent home the next day. So it's a very serious and very scary 24 hours. But if able to be controlled, then we get to the point where they get home and they have those long-term outcomes that we hope are going to be at least a year.
I have to tell you, when you get oxygen, it's like you crave it. Like when you need oxygen, like when you're sick, I bet that is such a relief for those dogs or cats.
Sure. I mean, we put them in small breed dogs go on an oxygen cage. We can crank up the oxygen to 100% if needed. We have many different ways to give oxygen. I mean, that's my heart. That's how I make animals feel better. Ventilation, mechanical ventilation, high flow oxygen, oxygen via mask, oxygen cages. We have multiple different ways to make them feel comfortable. And we watch them through the window in a glass oxygen cage, because we're counting their respiratory rate. We're like, okay, we just gave you furosemide. Okay, your heart rate's now from 65. Now it's about 45. We're like, okay, that's good. Not normal, but you're going in the right direction. And then a little more furosemide. Okay, they're going to urinate. Great. They're going to urinate out some of that extra fluid because we gave them the medication to create more urine, to get it away from the heart. So we track their respiratory rates very, very. This is why we tell people at home, we teach them how to measure the respiratory rate, because we do it in the hospital. It's a sign that we're doing the right thing. Also, when they're breathing hard and they're pumping their head and their neck is moving and their arms are like elbows are stuck out, and now they're like sitting like a real animal, and they're not breathing super hard with extra effort. That's another subjective assessment. The work that they take to breathe is a subjective assessment, but the rate that they breathe, that's a clear quantitative thing. So we use quantitative and qualitative things while we keep them monitored overnight, but they have to be addressed quickly. We have to get on top of it quickly. And then after we get them a little more stable, then they're going to be much more stable. We can take x-rays if we need to. We can get our echocardiogram done by our cardiologist, because you don't do that when they're having a crisis and they're in their worst state.
Right.
The emergency people, have to get them stabilized first so that it's safe for them to get their echocardiogram or their ultrasound or their x-rays.
Amazing.
Must be such a relief for the pet owner to see them in such distress. And once you stabilize them, it's kind of, oh, okay, I'm so glad I did this. And then you go on your chronic meds after that.
Yes.
But how rewarding for both you and the pet parent. And also, I think people don't realize when you go to the emergency room, Dr. Jandrey may not be able to see your pet that maybe has an anal gland problem because he's busy stabilizing a heart failure patient in room 2. So please be patient.
Yeah, that's a good point.
But anyway, let's talk about cats.
That's a very good point.
Tell me what you see most frequently.
Okay,
in
cats. Cats are a whole different bird when it comes to heart disease. So this is frustrating. This is one of the things that
they're sneaky. They never show anything.
Cats are stealth about everything. They're like, exactly. I'm fine. Nothing to see here. I'm fine.
Yeah,
right. Keep going.
Stop looking at me.
Exactly. So cats have hypertrophic cardiomyopathy. We talked about dilated is thin and bulbous.
Mm-hmm. Yeah.
Hypertrophic, hyper meaning bigger, trophy meaning, what is actually the Greek word for trophy? Change.
Not an M word. Okay.
It's the change. So the muscle has changed into thicker. So it's like someone with normal muscles just went to the gym, and the next day they were Arnold Schwarzenegger when they used to look like a 98-pound weakling. So instead of having normal muscles, you have super thick muscles. So the heart is bigger, yes, but it's bigger because the heart muscle's fatter. And because the heart muscle's fatter, what's got to give? It's the chamber where the blood flows. So because they have this fat heart muscle, the chamber is smaller, less room for blood. Because the heart's trying to move blood around, it's expecting a volume to be in that chamber. The chamber's now smaller. Not all the blood can kick into that chamber. It regurgitates back through the valve. The valve gets a little weaker. You get a big left atrium over time because that's where all the blood is not able to go into your left ventricle. It backs up into your lung. It creates the same kind of pulmonary edema or heart failure fluid that the dogs with mitral valve disease have. It's the same end result, fluid in your lungs, because it's backed up into your system. But the result is because one has a super fat heart muscle and the other one has a valvular disease. And cats are special, of course, because this thickening of the heart is 100% stealth. You don't know this is going on at all until it's really bad. How do you know this? Well, the most common sign of heart failure in a cat, you have two. One is respiratory distress. The other one is acute death. Making it really a shock. You're like, my 6-year-old cat was doing great, and I came home from work and I found it dead. Yeah, it's nuts. So they die for 2 different main reasons. One is because of a fatal arrhythmia.
Okay.
And people may have heard of famous athletes. I mean, when we were younger, Hank Gathers was one who was playing college ball, collapsed on the court during a game and died. He was found out to have hypertrophic cardiomyopathy. And many athletes also are super performers because they have hypertrophic cardiomyopathy. They can do a lot of activity with this big, robust heart. But what happens is because it's fatter, the electrical conduction through the heart is abnormal because it used to be a thin muscle to go through. Now it's a big fat muscle, and they get heart arrhythmias. Actually, heart arrhythmias because of hypertrophic cardiomyopathy are the number one cause in people of acute sudden death. It's unknown hypertrophic cardiomyopathy, like we have unknown hypertrophic cardiomyopathy in cats. So that's one of the causes. When that happens, basically coming home to find your cat dead in your house, with no other environmental change.
You wouldn't
No,
know.
the only way you would
and
know is to
that's not
have a
gonna show
post-mortem
you.
exam. Take your animal
Yeah.
to
Right.
your veterinarian to have a post-mortem exam. That's the
Wow.
only way to know. And there are some cats that are genetically predisposed and genetically going to have it. There are plenty of publications looking at there's many causes in people. There's mutations of the heart muscle protein that makes your heart super fat. There's similar protein genetic mutations that have caused that in cats, primarily Maine Coon breed cats. There are a couple other breeds that are coming on the scenes that might have a genetic predisposition. I think ragdolls are starting to get implicated. But our most common cat with HCM is just your average, everyday old domestic short hair cat.
Wait, there's a ragdoll breed of
Yeah,
cats?
it's really
What
cute.
is
Look it
that?
up on the internet.
I'm going to look it up. I've never heard that
They're
before.
cute. And they're ragdolly because they're kind of like
They're cute.
couch potatoes. They just hang on.
Oh, they're cute.
They're
Yeah.
really relaxed.
They're cute.
They are cute.
What about blood clots?
Yeah,
in
that's the
cats?
second reason that cats with hypertrophic.
Sorry, didn't mean to give it away.
No, that's okay. You keep me on track.
Okay.
Janet throws me off track. You put me back on track.
Oh, sorry. Blood
No,
clot?
Janet, this blood clot thing is really
Okay.
interesting and it's very
Okay,
sad.
so let's
too.
talk about hypertrophic cardiomyopathy, HCM. What it does, because the heart muscle is so fat, there's not enough room for blood in the chamber. The left atrium gets super big. Because it's super big, the blood flows very abnormally through that area. It tends to be very, instead of linear and straight, it tends to be swirly. Instead of like a slow moving river, it's like rapids. And so it slows down, it gets swirly, and the blood cells start whacking the inside of the chamber, and that creates a little bit of increased activity to create coagulation. It makes them more predisposed to building clots. So your body, backing up just a second, in physiology, your body knows how to bleed and clot at any given time. It's in a perfect balance such that your blood moving through your vessels and the lining of your vessels are partnered. The blood is trying to be on a straight line, marching through. The walls of the vessel are trying to be anticoagulant. They're trying to prevent any clotting from happening. But when something gets disrupted, like irregular blood flow, irregularity to the wall of the vessel, then we can change this balance to favor clot formation.
Mm-hmm.
The clot formation starts with little bits of blood cells, whether they're platelets or red cells or red cell fragments or white blood cells or pieces of the lining of your endothelium of the vessels. Those all can start to aggregate together, and they're more likely to aggregate when the blood flow is slow, irregular, or whacking against the inside of the vessels. A little tiny micro blood clot is not going to do anything really bad, but blood is blood. It's supposed to be a nice suspension moving through your body. Think of it like whole milk. It's supposed to look the same, move along smoothly, but it's a mix of different things. You do not want it to be like curdled cottage cheese running through your vessels.
Right.
You will clog the system like hair in the drain. Nothing's going to move. And when you create these clots, they get bigger and bigger and bigger and bigger, and they're stuck against the inside of the wall of one of the chambers of the heart. And at some point in time, that used to be a microclot, turned into a little bit of like a cauliflowery growth on the surface of the vessel or the chamber. For some reason, at one point in time, that little growth, the cauliflower-like clot, flies off, goes into the vasculature. And in cats, since the clot tends to be formed on the left side of the heart in the left atrium, the first big vessel it goes to is the aorta. The aorta leaves the heart, and it is the largest artery in the body. Large arteries, no big deal. Clots don't care. They just go flying. But as the heart's pushing blood around, everything's getting narrower and narrower and narrower. It's like you have the trunk of the tree, then the branches, then those little tiny branches, and then the tiny little leaf. Sooner or later, the clot's not going to fit in the vessels as they get smaller, as they work their way around the body. And this clot often will get lodged in the caudal aorta, which is the aorta in the back end of their body, about the area right around their bladder before it divides into their femoral arteries, one that each goes down each back leg. When you create this big cauliflower-like clot that gets stuck in your aorta and blocks flow to your legs, I can tell you, people know what happens to their cat. The cat screams in pain, starts breathing heavily because they're often in failure at the same time. They can't walk at all. And they need to be seen by a veterinarian ASAP. They are in excruciating pain because they're no longer getting blood flow to their back end. And 2 seconds before, they were having perfect blood flow. But it's this clot that got stuck.
Well, I have a question. So how big is a cat's heart? Like a human's is the size of your fist, right?
No, that's more like a dog.
That's like a dog?
Yeah.
Okay, a big dog, not a little guy.
This is probably a border collie Australian shepherd. It's a little bigger for a golden retriever.
I just can't imagine that little heart in there, even doing like a surgery on it, you know?
I know.
I can't even imagine.
Well, I have this funny thing that I think is about the size of a heart. It's the only thing on my arm.
Okay. I'm afraid to
Better
see
be
it.
good.
It's my little pig.
Oh, yeah. Okay.
But it's my little pig where you
cute.
would push on him, he poops out jelly beans.
Right.
So here's the size of my hand. I'm a size 8, and this is about the size of a cat heart.
But Janet, before we go, I want Karl to tell us, is there hope for those cats with that blood clot?
Oh, God.
Yeah. So there are, yes, there is hope. It's hard to overcome. This is what we would call like a huge Matterhorn to climb, and not everyone can climb the Matterhorn.
Yeah.
So of course they need oxygen, they need pain control, they probably need a little furosemide. And then the sooner they get to the veterinarian, the sooner they can get things started to actually try to dissolve that clot. Not your average everyday old general practitioner is going to have this medication. Some emergency clinics don't even have this medication, but there's a medication we give either directly on the clot using a fancy catheter, or we can give it systemically, putting the animal at risk for bleeding. But this is a drug to try to dissolve the clot. And the dissolvable clots tend to be the youngest ones. The older they are, the harder they are to dissolve. They use the same kind of thing in people. When people throw a clot, people tend to throw a clot to their brain. When they have AFib, AFib is the #1 cause of clots in people. And that clot in a human, they call it a stroke because it goes up a carotid artery and it hits somewhere in their brain. So if you have a stroke and they can determine where it is, within 3 hours, you'll get the same medication we give to cats. Pretty expensive medication, pretty expensive interventions. But there are things to do to try to get there. I can tell you most of the clients that I deal with, that I think most of us deal with, will actually euthanize the cat within the first 24 to 48 hours because we don't get a lot of improvement. If we do, it's great. But then they're also dealing with the cat's rest of its life as a heart failure cat who's always at risk to throw another clot.
Throwing more
And
clots.
most of the data suggests that they throw another clot within 8 months. So it's not a really it's a rough 8 months, a lot of medications, potentially lots of visits, and you're always worried that something bad's going to happen again.
And it's a cat, and you've got to give it oral meds, and that's
if it's a rag doll, they're very accepting, they're very chill.
Yeah, that's true.
Okay, so I have some new questions for our guests. What is one thing that people misunderstand about your field?
That veterinarians know a hell of a lot like physicians. Like it's a 4-year it's a 4-year medical degree after a 4-year bachelor's degree. We're in school the same amount of time. And people like me who do a year of internship and a 4-year residency to follow, it's just like going to see your neurosurgeon or your general surgeon. They do undergrad, vet school, internship, residency, specialty training. It's a long time to get smart to be able to do this kind of stuff. And it's hard.
And your patients don't talk, as you said earlier.
And sometimes that's better. But they're, the people who ask us to take care of their animals, they talk. We have to talk to them. And the other thing that I think is really funny, Janet, you probably don't hear this every day from a veterinarian, is I think veterinary medicine is the best people business you'll ever get into. because you have to love people first, because we're helping the
Yeah.
family. We're helping humanity. We're not just
Yeah.
helping an animal. We're
Amen.
helping the whole unit. So we're humanity people,
Yeah.
whereas physicians treat humans. I don't know if they treat animals or the environment that they live in. We treat everybody, and we love humans. We love people. Even if they don't think I'm
And it's a very emotional
Sure.
profession.
If they don't think I'm smart, I don't know stuff,
Yeah.
that's fine. I still like them. And I like the fact that they bring animals to me and that I can help them out. I can help them both out.
So what's the most surprising thing that you have learned in your field?
The most surprising thing that I have learned in my field, this is probably not so surprising, but I learn something every day. I still keep on learning.
That's fabulous.
I still learn.
That's
And
my
love it.
personal goal.
And love
I
it.
love it. I'm a
personal
nerd.
goal.
I'm a curious nerd.
I love learning.
It's just,
Yeah,
I
me
mean,
too.
I learned yesterday. Okay, I learned this yesterday. So, so there is a disease called retinal detachments. Retinal detachments happen in our animals because of a bunch of different things. When you detach your retina, so your retina is the back of your eye that actually creates the image from the light going through your cornea, through your lens, into the back of your eye. Your light hits the cells of your retina. The retina is like 9 layers thick. It has all the things to interpret what was out there into the image that we register in our brain. When your retina pops off the back of your eye, you can't see from that area anymore because it's not attached to all the other things, because it's floating out like a parachute. It's supposed to be stuck along the back of your eye, but it's floating. So our teams now at the VMTH here at Davis can actually put the retina back on the eye. They can actually do some fancy stuff, put some special fluid in there, push the retina back against the surface, and laser it through a very, very, very tiny hole, 25 gauge needle hole. This is the type of needle you would get when you get your vaccines. And they have a little mini laser that goes in, and they tack the retina down with a laser so that it stays back against the retina after it's popped off. I just learned that yesterday. I'm like, are you kidding me with that?
Incredible.
So
Oh my God.
Wow.
it's great.
That's incredible. We had a human friend. He had to lie in a massage table with his head down to take the pressure off.
Exactly.
When he
And
had
we have to tell the animals or the owners to say, there will be no tug of war. There will be no choking the collar. They're like, we have to have, because we have to actually allow it to heal. Because if they jostle it around, just like your friend on the massage table, if they jostle it around, they risk that the healing won't be ideal and it could pop off again. But I have my friends here in the hospital are now putting retinas back on.
A little laser.
Great.
Yeah.
It's very Jetson, laser.
And then Alice knows this. I worked for a veterinary ophthalmologist for my entire pre-veterinary life. And basically when animals detach their retinas, we're like, it's detached.
That's it.
Hopefully some of it stays.
That's where we met.
Yeah.
Yeah.
So I learned that yesterday,
Wow.
and I was like, this is so cool.
So
Advances
cool.
happen all the time.
So
Where's the world's best yellow lab?
Oh, he's right here on my feet.
That's good
Can
answer.
we take a
Oh,
look?
let me see if I can.
He's sleeping.
Boop, 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 boop.
What's his name?
Danson.
Oh.
Hey, Danson.
Look at that.
Dave.
Well,
listen,
thank you, Dr.
Carl,
Jandrey.
you know how much we love you. And thank you so much for doing the show. Anyway, this is Dr. Alice Novotny-Jeroman and
Janet Novotny King saying thank you for listening to Speaking of Pets podcast. We're here for you. Send us your questions. Share with your friends. We love likes.
anyway, thanks for
Thank
tuning
you.
in, everyone. Have a great day. Kiss the pets.
See you
for
later.
us.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts, because we love to have those likes. Thanks so much for listening.
That's actually really good. You could both go bye-bye.
Bye-bye.
Yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.